Good morning, everyone. Let's do NEET PG previous year questions. So, the question is like this that a 10-year-old presents with edema and NSARCA. A diagnosis of minimal change disease is made. So, the diagnosis is already given that it is minimal change disease. Now, the question is asked that which of the following is true about this condition कि minimal change disease से ये जो statements दी हुई हैं कौन सी right है. So the answer is that the minimal change disease have a good response to steroids. Now let's study in detail that what is minimal change disease. Minimal change disease have a good response to steroids, and it is a type of nephrotic syndrome in children, and it mainly or more commonly appears in males and in the age between 2 to 6 years of age. And the cause of minimal change disease, the most common cause is idiopathic, and it may be associated with Hodgkin's lymphoma, with respiratory infections, with prophylactic immunization, with eczema, with rhinitis. Okay, and in minimal change disease, what happen is that the proteinuria occurs. What is proteinuria? Proteinuria is proteins present in urine. Why proteins are present in urine? Generally, no proteins are present in urine, but in minimal change disease, proteins are present in urine because proteins are filtered out in glomerulus. That's why the proteinuria happened. Now, what will be the child present? As you know that proteinuria is happening, if proteinuria, the most common protein that will excrete out is albumin. And you know that albumin is responsible to maintain the osmotic pressures. If the osmotic pressures are not maintained due to the excretion of albumin, there will be edema in our body. And this edema will first, the location, the first site where the edema will be shown, that is around the eyes. That is periorbital edema will be present as first, and then it will gradually progress into generalized edema. Now, there is some proteins in which there are some proteins whose level will increased in minimal change disease. These proteins are fibrinogen and lipoproteins. If fibrinogen will increase, what will happen? There will be hypercoagulability. If there will be hypercoagulability, then the thrombus will be formed very rapidly. Next is lipoproteins are increased because there is increased synthesis of lipoproteins in result of decreased albumin in our body. Next is that there is proteinuria because the selective proteins are excreted out. What are these selective proteins? These selective proteins are albumin, first of all and most important, that is albumin. The largest proportion of albumin is lost in nephrotic syndrome. Next is transferrin. Next is thyroxine binding globulin. Next is ferritin. Next is coagulation factors. Next is antithrombin 3. Okay, so this is all about proteinuria that is present in minimal change disease. And to diagnose proteinuria, how we will diagnose proteinuria? that a patient is having a proteinuria edema is a presentation, but we have to diagnose it by a lab and investigation or by something. Then we will do a urine analysis which will show the proteinuria. Proteinuria is if it is +3 to +4 protein on urine dipstick, and a spot urine protein creatinine ratio, spot protein creatinine ratio should be more than 2, then it is known as proteinuria. And we know that principally the proteinuria contains albumin, and the serum albumin level, we can check the serum albumin level also. The serum albumin levels will be decreased and they will be less than 2.5 gram per deciliter, and there will be increased lipoproteins and there will be increased level of cholesterol and triglycerides. And on doing biopsy of the glomerulus, then on light microscopy, the glomeruli appear normal. Why the glomeruli appear normal? As the name represents, there is minimal change disease. Minimal means approximate no change. The glomeruli will appear normal. Next, we will do the immunofluorescence studies. Immunofluorescence studies shows no immunoglobulin or complement deposits. Next we can do is electron microscopy. In electron microscopy, there is diffuse effacement of food processes of podocytes. So on electron microscopy, there is a diffuse effacement of food processes of podocytes. But in option, what was given, that on light microscopy shows effacement of podocytes, so that is wrong. And we know that it is most common in children and it is a selective proteinuria. So this is all about minimal change disease, and we know that minimal change disease have a good response to steroids, and the steroids used for minimal change disease in children are prednisolone. And by these steroid, there will be a complete remission. The problem will be solved completely. The patient will be free of the disease. Thank you so much for watching this video. Hope you enjoyed it. These are previous year NEET questions and the explanation with it, why the answers, why these options have been chosen. So thank you so much for watching this video. Hope you enjoyed it. Like, share and subscribe. Thank you.